We founded THET to work with our colleagues in the medical training institutions in Africa to go to their goals, not goals which were internationally dictated or politically expedient, but to the goals which they knew had to be reached.
The links are important there for us because they have really helped to improve the capacity of our hospitals. And as a result, those hospitals which have linked with a particular hospital in the UK have really increased in their outputs in the areas in which we collaborate.
First of all, thank you very much for welcoming us here. We already feel like a part of the family. The Tropical Health Education Trust think education of the workforce is the most important, and that is also our goal. And that's why we are very, very keen on training of the health center staff and now the community workers.
Since the link started helping us, the health center has better things. The work experience of the health workers is also maintained because they give us different trainings at different time, on-job trainings. I can say I think the link is the reason why I'm still working at this health center.
Pull up.
Not breathing, help me, please.
And this side, we find that there's no breath sounds because the nerves run there, right? Otherwise, you can damage the nerves. Yeah.
The baby needs to be born quite quickly. Once the head is born, then the
THET is respected in a country like Ethiopia because they have undertaken directly a project and delivered.
They make sure that any links that are set up are ones which fit in that developing country, are what the developing country itself puts as a priority.
We get so many things from this link. There is a visible improvement in every direction. When I go there, I learn, and Nottingham nurses are come here, also they are learning here, you know, it's exchanging.
Yeah? So this is a good way of doing. We've both learned something.
Well, she's saturating quite well and she's only on 30% oxygen.
Nursing care doesn't change really. Yes, we've not got all the equipment that we've got back home, we've not got all the resources. However, you should be able to use good basic nursing care no matter where you work.
We have been coming here at least once a month since 5 years ago. At the moment here we had registered about 200 patients, and most of these ones had not accessed mental health services at all. Previously, very few people were aware that mental illness can be treated. And we have worked with the traditional healers, and some of them have started referring patients to us. We thank THET for its contribution. Much work has been done. Patients have benefited from it. Community members have benefited. The staffs in the hospital have benefited. So it has changed a lot in the lives of patients.
These links don't benefit only one side, because when we send our health workers in UK institutions, they learn and they also teach the people who are there how we practice in a resource-constrained environment.
There's one peak here, there's another peak here. However, we have one unifying factor, and that's that cancer. It cuts across both races, cuts across ages, cuts across everything. So we have that unifying factor there across Atlantic.
The latest person to come is Dolapo Afuwape. He's a general surgeon, a lecturer in surgery from Ibadan in Nigeria. He was responsible for running the accident and emergency department in Ibadan. One of their problems is that they see a lot of trauma patients. And one of their big difficulties is that many of those patients die within the first few hours of coming to hospital.
As you pull it up to the right shoulder, it goes to close. Yeah, I want to pull it down this way. You can't, often the gallbladder will go over the liver edge. You will put it up towards the right shoulder. To me, that closes Callow's triangle.
Okay, so that holds the traction in place for him now.
Yeah.
It's amazing that what I do on my own back home in terms of managing the patient, they sit down together, it's like a teamwork here. You find the surgeons discussing with the radiation oncologist, discussing with the radiologist too, to manage one single patient. The doctor or the surgeon in Nigeria can come to the UK, spend a few weeks, see what is done, see how it is done. He can get back home. He doesn't feel that there's a wide gap between himself and the man in the UK, and therefore he can save more lives, basically.